Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Sara Gibbs is a nurse at Buffalo General Medical Center and the Gates Vascular Institute. Sara, thanks for joining us today.
Thank you.
I can see you're on break right now or taking some time off from one of your long shifts. If you can, let's start by talking a little bit about you. How long have you been a nurse and how long have you worked at Buffalo General?
Well, I've been a nurse 26 years. I've been with Kaleida 14. I started at Millard Fillmore Gates Circle and then came over to BGMC in 2011 when we merged.
So in that time, you obviously have seen quite a bit come through the emergency room, from the routine ER visits to preparing for things like SARS, H1N1, Asian bird flu. There's an awful lot of public health issues that we've seen over the last decade or so. But this seems to be much different, and it's obviously much more acute. How has your training, your experience prepared you for this?
Well, I think working in the ER is challenging on a daily basis, but this adds an extra element to it. In the ER, we're very good at thinking out of the box and thinking on the fly. So we're dealing with this as best we can. We have to think about more than COVID, so that's an issue as well, keeping all the patients safe, not just treating the COVID patients.
Sure. Before we get to the COVID patients, let's start with your other patients that you see. You still are seeing patients come in with stroke issues, cardiac issues, any other type of routine ER visits that people still need to come in and be seen. So tell us a little bit what it's like to see those patients right now.
Well, it's hard. Sometimes our stroke patients aren't able to verbalize their complaints. And so we're working very close with EMS and getting good screening on them. And we do have a separate area in the emergency department for strictly COVID patients. So if the doctor does a quick screening, determines, they're not at risk for COVID, we try to separate those patients. So just like a clean versus dirty area. So sure. That seems to be working really well.
So let's dig down a little bit further into that. So that specific unit, that pod that you guys have kind of cordoned off for the COVID patients, what's it like working in there? I was down rounding late last week and saw everybody's gowned up, masked up, has their shields on, taking precaution, PPE, all that. Tell us what it's like working in that type of area.
It's pretty stressful, and we do try to rotate the staff through that pod so people aren't getting burnout. But, wearing all that PPE adds an extra element to the job that makes it a little less comfortable than what we're used to. Plus, you're trying to emotionally support the patients as well without having family here. So you're not only taking care of them medically, you're trying to help with their emotional needs because they're scared and they're alone. So.
What really stuck out to me when I was down in the ER rounding was, despite the stress, despite the anxiety, despite the extra PPE that you guys are having to wear for very long periods of time, the staff was in a pretty good mood and seemed to be dealing with this well. Is that because of who you guys are? Is that emergency room nurses overall?
Yeah, I think so. I think that's definitely a quality that we all have. I have to say there's been a great outpouring with community support. We've been getting cards and cookies and meals, and it's just really helped to lighten everybody's load. And I also would like to, if I could, take a minute to just thank our families. Without our family support, we wouldn't be able to do the jobs we do. Our families watching the news, they know that this is dangerous, it's highly contagious, and they support us and allow us to come to work every day and do what we do, is take care of people.
Let me ask you a little bit more about that. I mean, it's stressful enough dealing with what you have to deal with at work. I mean, you are literally on the front lines as these people are coming through the doors. But then there's the stress and the anxiety at home of, first leaving to go to work and have to worry about, who and when you leave things behind, but also the day-to-day functioning of your life. So whether, we have kids in school or you have kids that are graduated or what have you. So, that combined stress of coming to and from work, what's that like?
It's pretty stressful. A lot of nurses, environmental staff have been wearing clothes, changing their clothes here. We do have the ability to shower if you choose to in our locker room, and then bagging up their scrubs and, just taking every precaution we can to keep the community and our family safe at home while we take care of the patients here.
This is probably something, maybe you get tired of being asked the question, but for the viewers who are watching this, and I'm sure you get asked this by your family members, your friends, what is it like? What do you see? What's it like being in the emergency room in the middle of a pandemic, a life-altering pandemic? You are literally on the front line. What's it like working these days?
It's pretty stressful. Definitely the most stressful time that I've experienced personally as a nurse. We do try to, at home, limit the amount of news coverage. I don't like to talk about COVID when I get home, just to kind of have a safe place, de-stress, relax, and recoup for the next shift. But we all do work really well together and get the job done.
So that team aspect, and I know I'm talking to an RN, but you guys function as a pretty tight team there, from environmental services to dietary.
Yes.
If you can tell us what it's like, the team aspect.
It's been great. I'd really like to thank environmental, transport, dietary. It's definitely a team effort. Just work together to take care of these patients, and it takes more staff to take, you're gowning up, you're taking your gowns off. Their patients are coming in very sick. It's taking multiple nurses in one room. So we all have to work together and have a point person run for supplies, stay outside the room, answer it. So it's definitely a team effort. But from my experience, we've all been working great together. And, I'm really proud to be a nurse right now.
Well, thank you for your time. We realize this is, a very hectic, stressful, anxiety-filled time for you and your coworkers. So we do appreciate that. So on behalf of a grateful community and grateful organization, thanks for all that you do.
Well, thank you.